Health Focus is brought to you by National Medical Stores, NMS, passionate about your life.
Advance Kenoiri is elated about the birth of her second-born safely. We found the two and her grandmother, the caretaker, at Ruhija Health Center 2, deep inside the hilly and lush green environment of Rubanda district. Kenoiri and the grandmother traveled for about 35 kilometers to reach the health center, a journey that cost them about 60,000 shillings on border borders. She explains why she opted to come here instead of the government facility that is within reach.
Here,
she will now be the last mother to give birth in this poor quality maternity ward. A newly constructed and better equipped maternity ward has been donated by the Joint Medical Stores. There are many aspects that define the quality of health service a certain population receives, and among them is infrastructure at health facility level. Now, this facility in my background will be providing a better service to the population of Ruhija, which for a very long time has been receiving poor maternity services. Alan Nimbasa is an enrolled nurse and also doubles as the facility in charge here. He explains the changes at the facility that will enhance better service delivery.
We've had the instruments to use. We are using the already delivery bed, and it was not good for us. But we have been provided with now 2 delivery beds, the delivery instruments where we never had the amp bag in case we had like any asphyxiated baby, we couldn't resuscitate that baby. But now we have the amp bag, we have the suction machine, even deliveries, we never had equipments to use, so we have very many now. And the building we used it to have, it was very small.
Better service delivery in health is linked to achieving of global targets like Sustainable Development Goals, which include the delivery of interventions to reduce child mortality, maternal mortality, and the burden of HIV, AIDS, tuberculosis, and malaria. Ruhija Health Center 2 delivers about 30 mothers a month. This is why the in-charge wants it elevated to a Health Center 3.
We have serious workers, one of them me as an in-charge, you have a midwife and a nurse that I'm working with. If it changes from this health center to health center 3, we need a clinical officer this side. And we can even get some nurses, we can add some 2 nurses or a midwife also to help on that midwife we have, because we have only 1 midwife and we find we are helping that midwife also.
From Rubanda to come here, it is hard to reach area. And as you can see, the terrain and the environment. I said whatever is available, the people of Ruhija need it first. And to minimize on the complications and to have safe deliveries.
The total that JMS has put in is 70 million shillings. We have also promised today that we will put in addition beds for the ward. So in addition put in, they said 6 beds, I think, which are needed here, which will cost maybe an additional 20 million or so. So the total will come to approximately 90 million.
In Kasesa district, Kilembe Mines Hospital, which was in 2020 washed away by floods from the Rwenzori mountain, is now serving the population once again after receiving support from the Catholic Church and Joint Medical Stores. However, they are now operating in a space originally meant for a school.
Transforming a school, moreover a nursery school, into a hospital, a big hospital, general hospital, that even offers some special services was not easy. We need a new X-ray machine. We need a new ultrasound machine.
We have also donated to them 2 items, a fetal Doppler, which is a machine used to monitor the heartbeat of the baby while the baby is still in the mother's uterus. And we have also donated an oxygen concentrator which is a machine that is used to collect raw air and then process it and bring out high concentration oxygen for patients that need oxygen.
The Permanent Secretary at the Ministry of Health, Dr. Diana Atwine, while on support supervision in the region, said government is still constrained on how to support the private not-for-profit hospital serving more than 3 districts.
We left them with the task of making sure that they look for suitable land. They survey it. Once all that process is done, then they come back to us, and then we start sourcing for funding after getting to know that the land is available, and also the sorting the politics of the district, because the district was the authority in the district. The local government was saying, you want to build a PNFP facility, but the district doesn't have a hospital as government. So which one do you prefer? So
Dr. Atwine also commissioned the medicines and equipment store in Fort Portal, which she says will help in supplying the region's government and private not-for-profit health facilities.
We really want to congratulate also the people of Rwenzori region that now they can access medicines quickly. It is just a call away, it is just coming here, make an order, and then their medicines are delivered immediately. And this has definitely implication on the quality of services.
Service provision or delivery is an immediate output of the inputs into the health system, such as the health workforce, procurement and supplies, and financing. Increased inputs should lead to improved service delivery and enhanced access to services. Walter Mwesije, NTV.
National Medical Stores, NMS, passionate about your life, with support from the Ministry of Health. Procure, store and distribute essential medicine and medical supplies to all government health facilities in Uganda.